Good afternoon, and thank you for joining me for the last of the regular Welsh Government press briefings ahead of the Cynhadledd elections. As the First Minister said on Friday, he will hold briefings following the next two 21-day reviews of the coronavirus regulations to make sure that you have the latest information about any changes to the restrictions. Today, I want to focus on our plan for NHS recovery, including how we will support people suffering with long COVID. I do though want to start by saying a few words about our vaccination programme. Thanks to the hard work of our incredible teams of vaccinators across Wales, we have had another fantastic weekend of delivery. I'm very pleased to be able to tell you that over 50% of the adult population in Wales have now had their first dose of the vaccine. And this really is remarkable progress in less than 4 months since the start of the vaccination programme here in Wales. And almost 350,000 people have completed the full 2-dose course. Our health and care service and the tens of thousands of people working in it have been at the heart of our response to the pandemic. They played a vital role in keeping all of us safe over this last year. From rolling out the vaccination programme at record speed, to maintaining essential NHS services throughout the pandemic, to caring for the thousands of people who have been admitted to hospital with COVID. Their tireless work and dedication is the reason why I announced a special bonus payment for more than 220,000 health and care staff. This goes a small way to expressing our enormous gratitude for everything that they have done over the last year, often under intense pressure and in the most difficult of circumstances. Our NHS, like all other parts of our lives, has been affected by coronavirus. The huge number of people who have needed hospital treatment for coronavirus over the last 12 months has unfortunately led to delays for planned appointments and treatment. More than 200,000 people have tested positive for coronavirus, and there have been more than 30,000 coronavirus-related hospital admissions. As a result, we've seen waiting lists grow as people continue to be referred to hospital. The list currently stands at more than 540,000, and around 60% of the list relates to new outpatient appointments. The expansion of critical care capacity to treat seriously ill patients, combined with the measures that we took to protect people from contracting coronavirus in outpatient clinics and surgeries, has dramatically reduced NHS capacity to see and treat people. And of course, our NHS staff have not been immune to coronavirus. They are at increased risk of catching the virus and, of course, have also, from time to time, had to self-isolate if they or a member of their family or household has become ill. It is our priority to make sure that people waiting for treatment get their treatment. We do not want people's health deteriorating or people coming to harm while they're on a waiting list. The plan we're publishing today is backed by an initial investment of £100 million to help our NHS and care services to recover from the pandemic. It sets out some new ways of working, including changes to outpatients. We want to see more people sent straight for tests before they see a consultant, instead of multiple appointments and trips to and from the hospital before they have diagnostic tests. And we want greater use of virtual appointments. Before the pandemic, only 8% of outpatient consultations were virtual. This now stands at 34%, so more than 1 in 3. We will also create new planned care pathways and regional centres, which can be better protected in the event of future waves of coronavirus or other disease outbreaks like, for example, flu. These are just some of the measures that will help our NHS to address the waiting list backlog. But this plan is about more than just recovering waiting times activity. It looks at the entire range of our NHS services, from primary care to emergencies to mental health services. In primary care, we can reduce the need for people to be referred to hospital. For example, eye care services working with optometrists in the community, and we can build on the developments made during the pandemic to further strengthen our community pharmacy services. Our modelling suggests that an increase in the demand for primary care mental health services of up to 40%, which could translate in up to 31,000 referrals. The NHS must have the services in place to be able to respond. The mental health budget remains the single largest area of spending within our NHS. But if we are to prevent lifelong mental health problems, we need to spend more on services for children and young people who are experiencing mental health issues. Health boards also need to do more to make easy to access mental health support available locally. Now, the last year has seen huge change in our NHS as more care has been provided remotely. So we're going to invest £1.26 million to set up a centre to promote the use of new technologies in health and social care. This will promote the use of new technologies such as virtual consultation and remote monitoring of patients in their own home. We will continue to ensure that people who need to be seen in person can still access face-to-face services. Now, before I take questions, I want to return to long COVID. We've always been clear that we want people with long COVID to have access to care as close to home as possible. All NHS organisations have details of the All Wales Community Pathway for long COVID. This complements the NICE guidelines in place and are designed to deliver a consistent response for people wherever they live. We're also working with support groups to learn from people's direct experiences to help shape and improve services. The management of people with long COVID is one of the 4 priorities for primary care in our NHS recovery plan. The new Wales COVID-19 Evidence Centre has been set up, and it will work closely with the NHS and social care to analyse the impact of coronavirus and use evidence to address these new challenges. Its work programme will include research into long COVID. And earlier this month, the Minister for Mental Health, Wellbeing and the Welsh Language met ministers from across the UK, Scottish and Northern Irish governments to agree work on long COVID, including research and understanding how many people have been affected. Thank you very much, and thank you for watching these briefings during the pandemic that as yet remains unfinished, and I hope that at home you have found them helpful. I'll now take questions from journalists, and as usual, and for the last time in these press conferences, all the answers will be broadcast live on our social media channels. And the first question today is from Owen Clark from BBC Wales.
Diolch yn fawr, Gweinidog Iechyd. One of the tragedies of the pandemic, of course, has been how it's highlighted the stark inequalities in society, with the poorest communities on the whole suffering the most. Given the scale of the waiting lists and waiting times at the minute, do you think there's a real risk of that disadvantage being worsened because at the moment people who have the ability to pay for private treatment will be seen far quicker than ever before compared to people that can't?
Well, there's a complete section on how we need to reduce health inequalities further to help build a fairer Wales in the recovery plan. It's also in the National Clinical Framework that's been published today with a foreword from our Chief Medical Officer. And you'll also recall that the Chief Medical Officer's report this year has looked at a range of issues that have been highlighted by the pandemic, including healthcare inequalities. Now, there is always a risk that if you allow a position to build up over time that you don't then address, that you'll see people being able to get ahead of the queue and to pay for treatment. But we're in a pretty extraordinary position at present, where actually the independent sector right across the UK is going to be full as well. Because we got such an extraordinary amount of volume in our system, the number of people waiting, we're not going to be able to buy activity in the independent sector. We're actually going to need to have some conversations with them about how we make best use of the capacity they have to help us get back on top of the huge waiting list challenge that we have. Now, I don't think actually it's just about buying activity on the basis of the more advantaged, financially advantaged people being able to get ahead. Actually, the biggest challenges in our healthcare inequalities are about people waiting and potentially coming to harm. And it is the case that those people are more likely to come to harm, are more likely to be from our least well-off communities. That's why there's such a significant focus on healthcare inequalities in the plan. And there's an opportunity to remake and rebuild our health and care system so it becomes a genuinely sustainable endeavour for the future. And that must go alongside what we can all do to live our lives differently and all those things outside the health service that have a direct impact on healthcare inequalities. And crucially, the world of work and good work makes a huge contribution to healthcare inequalities, as you'll know, Owain.
Diolch yn fawr. One of your priorities throughout this, of course, has been to avoid a situation where the NHS could become overwhelmed. Now, gladly, at the moment at least, that's looking less and less likely, given that restrictions in any form cause harm to people, not least to people's health and well-being. Do you think there needs to be an added momentum now, or a commitment to hasten the prospect of easing restrictions?
Actually, Owen, when you look at the evidence of where the people of Wales are, they actually welcome and want us to continue to adopt a cautious approach that is driven by the evidence. There are noises from the fringes of politics for demands to have a more ambitious and more urgent programme, a roadmap that is driven by dates, not data. But that isn't where the Welsh Government is, and it isn't where the people of Wales are. And crucially, that's because the scientific evidence and advice that we have, both from our own technical advisory group and SAGE, the group of scientific experts that advise governments across the UK, and our chief medical officers, are all telling us that if we move too quickly, we could throw away all of the hard work and collective sacrifice of people in Wales and other parts of the UK to help significantly reduce coronavirus harm. Now, I wouldn't want to do that, and I don't think anyone would really expect the Welsh Government to suddenly throw open the doors and act as if we can have all the restrictions magically taken away by a point in time on a nominated date. I think people want to know that we're doing this in a way that is responsible, that follows and respects the evidence and the science, and that's the approach that we have taken. That's why we've got a map that sets out easements for the next 6 weeks or so, and we'll then have to return to those when we're undertaking the next 21-day review to look at what is possible next, how much headroom we have, and how we do that while balancing the harms that lockdown can cause and balancing the huge harm that we've seen when coronavirus gets out of control. And I certainly, having lived through the last 12 months, as indeed all of us who are watching and listening to this have, I certainly reflect back on this last year, on the tremendous harm that's been done. People that have recovered but been seriously unwell, and those people who have lost their lives. And I certainly won't be advocating a course of action that could risk a further repeat of that through the summer or the autumn. Thank you, Owain. I've now got James Crichton-Smith from ITV Wales.
Thank you, Health Minister. How are you going to ensure you have the staff who are already exhausted by this pandemic to carry out your recovery plan when so many are probably thinking of packing it in?
Well, there is a real challenge for our NHS staff, and it's one of the things that I think is really important, not just for our NHS staff, but in public debate as well, about what our expectations are for recovery. I know there are some voices who claim that we can already be making a start to essentially go hammer and tongs at undertaking more elective activity. And actually, we know that the waiting list is likely to expand further before we're out of the pandemic. That's because, as I've set out in this statement and in others that I've made, we know that our NHS can't operate at full capacity, and we know that there's suppressed demand and need that exists as well. I had a meeting with the NHS Wales Partnership Forum. It brings together the government, employers and NHS trade unions as well. And there was a very grown-up conversation about compassionate leadership. Now, that may not mean much to people outside the NHS, but it's actually about how we take care of our staff, how leaders behave in the expectations we set that are consistent with NHS values, but recognises how exhausted our staff are. So that's why within the recovery framework we've published, we've recognised we're going to need to take care of our staff, to continue to invest in the future, but to take care of the staff that we have. And that's why this recovery will take a full Welsh Parliament term, And people who claim it can all be done within a year or two are not being straight with the public, and indeed they're placing a wholly unrealistic burden upon our staff.
Thank you. Assuming health boards are taking local responsibility for this plan, how are you going to ensure there isn't a postcode lottery for services?
Well, when you have time to look at the plan in more detail and the clinical framework that goes alongside it, you'll see that we're going to need to have a mix of local, regional and national. And I think whoever is in this position as a health minister after the Senedd elections will need to be prepared to direct parts of our service, whether that's a direction about what a regional service could look like or a national service. We've already done some of that, of course. We've got a nationally directed programme for endoscopy recovery and improvement as well. So there are a range of areas where we're expecting health boards to work locally, but there's also an expectation they're not just looking within the borders of their own health board boundary, but looking to work expansively with others. And of course that takes place in a range of service areas already. For example, there's a consultation ongoing about reforming complex vascular surgery within South East Wales. And that works across at least 3 different health boards. But that's the right thing to do to make sure we have a sustainable and high quality service that will take in patients from across 3 different health board areas at least. Now that's the right sort of approach. We're going to need more of that in the future, but not just for those highly specialised services. We're going to need to see lots of collaboration across planned care as well. So you can expect to see the way that elective care is delivered, being delivered on a different footprint and a different basis, but that should deliver the volume and the quality we'll all need. And I also think that'll be a good place for our staff to work in, as well, of course, as a good place for people to continue receiving high quality NHS care. Thank you, James. And now I've got Mark Smith from Wales Online.
Thank you very much indeed, Health Minister. First Minister Mark Drakeford has said that Wales will not return to normality in 2021. So bearing in mind that the Astrazeneca vaccine has today been said to be 100% effective against serious illness, and no matter how successful the vaccine programme is, there will always be a proportion of society who are not vaccinated, including children and people who simply refuse the vaccine. When do you see life in Wales returning to normality?
Well, I think it's really hard to give a forecast because apart from anything else, you need to ask yourself, what is normal? You know, the new normal may not be where we were 18 months ago in terms of people's expectations, how people behave. Some of the changes could be positive for us. You know, the whole point about respiratory hygiene, about whether people will start to wear face coverings more normally, that'll be a choice some people make. But I hope what those standard campaigns about the flu that you'll recall seeing, catch it, kill it, catch it, bin it, kill it. Well, actually, we may see a greater adherence to that. We may see more people being prepared to take up the seasonal flu vaccine. And indeed, the new normal will likely include a COVID booster or catch-up programme on vaccinations. There'll be many things that'll be different. What we're trying to be honest about is that within the next few months, we're unlikely to see an easing of all restrictions and everything can go back to people doing whatever they want, when they want. That isn't just the view of the Welsh Government, that is the view of all the scientific advisors and experts right across the UK. Our own advisors here in the Technical Advisory Group, chief medical officers across the UK, and indeed the SAGE group of scientific experts who advise all governments in the UK. None of them are saying that you can have 0 restrictions and 0 harm from COVID at a certain point in the rest of this year. So we need to level with the public and be honest with them about the fact that some restrictions are likely at points in the year. It's about how fast we get through this next stage of vaccinating everyone, reducing harm, and then to look at what can be possible in a new normal as we move forward. But if you cast your minds back to the end of last summer, we didn't have 0 restrictions in place, but actually we could do a number of things together in a different way. That could be a more sustainable pattern for us as we get through this year. But, you know, I don't expect to return to foreign holidays and travel anytime soon. And I'd be very surprised if I were taking a foreign holiday over the summer, because we need to think about what's happening here as well as what's happening in other parts of the world. So big risks for us to manage, but to manage them successfully, I think that does require honesty from the government and honesty about what the evidence is telling us. And that's exactly where this Welsh Government is.
Thank you very much indeed. And secondly, despite obviously the encouraging news about vaccine uptake in Wales, there remain more than 4,000 care home workers and 14,000 healthcare workers yet to have their first jab. And over recent days, the number of people in these priority groups receiving the vaccine has slowed down. So does it concern you that there are still so many outstanding in these groups? And what is the Welsh Government doing to encourage frontline workers to have the vaccine for the good of the people they're looking after?
Well, as you know, we've been extraordinarily successful at getting frontline workers not just the opportunity to have their vaccine, but persuading them to take up the protection the vaccine offers. If you look at the percentage figures, we're well over 90% in most of those categories. So actually, we've been very, very successful. And part of this is about understanding that some people will be hesitant. You know, our health and social care staff are often like the rest of the public. The same fake news, the same anti-vaccine fears that are spread and circulate can affect our staff too. And so as we go through the different age ranges, we're likely to come up against slightly more vaccine hesitancy in younger age groups. And I think you're seeing some of that within our health and care workforce. So it's about being consistent and honest about the evidence, persuading people to take up the protection the vaccine offers, and reflecting the fact that the best way to persuade them to do so is by evidence and conversation with their peers, people they trust, and not trying to take a very hard line approach that I think could drive people away. So I think we should take heart in how successful the programme has been, how successful we are compared to other parts of the world, and we don't often talk up Welsh success on a European or world stage, but our vaccination programme is something we should really, really be proud of. And I'm confident we'll see very high numbers of our frontline health and care staff continue to take up both doses of the vaccine to protect them, their families, and the people they care for. Thank you, Mark. I've now got Rebecca Miles from LBC.
Thank you, Minister. Well, hospitality businesses across Wales told us last summer they lost thousands of pounds, and when the restrictions were eased up slightly, they still weren't able to operate fully. So looking ahead to this summer, with many more people expected to stay closer to home, are you concerned that we might see a rise in COVID cases in some of our seaside towns and holiday hotspots, whilst at the same time businesses there are continuing to struggle?
Well, it's part of the difficult balance we have on opening up the economy and more areas of more normal life and the way people can mix and see each other, and the reality that if we aren't able to suppress coronavirus still in these early stages, we could end up seeing a return of coronavirus with a vengeance later in the summer. So that's the balance we're always trying to strike, in recognising that we want people, whether in hospitality or other businesses, to be able to turn a profit, to pay their staff, and to not need the extraordinary levels of support that have been provided by the Welsh Government and through the furlough scheme as well, whilst keeping their staff and their customers safe. So there isn't a way to avoid that balance of restrictions and measures. It's about easing our way through and understanding the science, but also the evidence of what happens at each stage. So that's what we're trying to do, and I certainly hope that hospitality and tourism businesses across Wales will have a good year, with more people still likely to stay local, to stay within Wales or the UK. And I certainly hope that people will enjoy seeing more of what our fantastic country has to offer, but to do so in a way that is safe and respects the fact that there are other people around there, and we may still need to have some closing down of our social circles compared to what we might have done a couple of summers ago, but we should still be able to do an awful lot together if we don't throw away the hard work and collective sacrifice that has seen us to this point, where we really have got much, much lower levels of coronavirus circulating in Wales, and we're on a path to opening up cautiously but steadily to see our way through, hopefully, to the end of the pandemic.
You've said this lunchtime you don't expect summer holidays abroad to be on the cards for many people here in Wales. So with that, obviously that will devastate many travel agents here, and also the Cardiff Airport, which of course the Welsh Government has a big stake in. Is there a plan to minimise that devastation?
Well, I wouldn't quite call it devastation. It's the honesty of where we are. And actually, if you talk to people in the travel industry, then many of them are expecting there'll be practical measures that either airlines and other carriers themselves will introduce. For example, most major cruise companies have already said they'll expect people to demonstrate evidence of a vaccine before they can go onto a cruise ship. If you're looking to fly away, then it's the case today that if you are able to travel, you can expect to isolate on your return. And we also need to reflect that most of the holiday destinations that many of us would be thinking about are travel into mainland Europe. Well, actually, within mainland Europe, we know that there are increasing measures being taken because of a rise in cases across Europe, and we're at a different place in terms of the rollout of our vaccination programme. So there'll be a lot that needs to happen, not just within the UK, but within those popular travel destinations as well. Now, people would need to factor in, would they need to go on holiday, potentially then having to come back after a break and still need to isolate at home for a period of time afterwards? For many people, that isn't going to be an attractive option. It doesn't mean that international travel is off the agenda forever, but it does mean we've got to think about the risks that come with it as well. Because I certainly recall that through last summer, the re-importation of coronavirus was heavily associated with international travel into Europe. And you'll recall I had to change rules while there were planes in the air because that was the right thing to do to protect people who were returning and the families and communities they were returning to. So this isn't straightforward, and it's about taking this one step at a time to which we understand the picture here in the UK, but also those places where other people will be looking to return to if international travel is back on the agenda for most of us. Thank you, Rebecca. I've now got Nicholas Thomas from The National.
Thank you, Minister. 20 leading cancer charities say the Welsh Government's NHS COVID recovery plan doesn't look enough at the long-term strategy for cancer care. What is the Welsh Government's long-term plan for cancer patients' treatment, services and waiting lists?
So today we've published a number of documents. We've published the NHS recovery plan. That sets out a broad framework for all NHS services, as I said in my introduction. That looks at planned care, it looks at primary care, it looks at secondary care, hospital-based care, it looks at mental health recovery as well. So look at all areas of the service and how we're going to need to recover together. We've also published a national clinical framework that delivers on commitments we made in A Healthier Wales, our long-term plan for health and social care. And within that, we signalled a series of quality statements. They set out our expectations of what health boards will deliver. And that'll go into the direct accountability framework we have with the NHS on seeing how they deliver their plans through each health board area. So it'll be much more central to the planning and delivery process. Now we're going to need to develop some more detailed delivery plans. So health boards will need to set out what they're going to do to deliver against the quality statements we've published already for both heart conditions and cancer services. So actually you're going to see a lot of detail in the delivery around those areas, and they'll have to set out how they're going to deliver against the expectations in the quality statements. Now, for many people watching, this may sound like a bit of a word soup. What it essentially means is we've set out our expectations for health boards to deliver against. They then have to provide a detailed plan to deliver against those, and you won't see that detailed plan for some weeks to come, because in the normal way our NHS plans, we wouldn't see the detail of the plans till the end of this month. And of course, we're still dealing with a pandemic that is interrupting normal treatments. So I still think that not just cancer charities, but a whole range of areas of interest we'll see in the areas that they are most passionate about. You'll see detailed plans from our NHS that are all there to deliver both the recovery we need to see in each of those areas and then the longer term delivery of high quality, sustainable services.
Thank you very much. The First Minister has said that an inquiry will be held when the pandemic is behind us. But on the first anniversary of the first lockdown beginning in the UK, what do you think are the toughest, most important lessons that the Welsh Government has learned so far?
I think the toughest lessons are the fact that the virus will constantly surprise. Its ability to change, to continue transmitting, and the way that the mutations have worked. So the variant we now have now is even faster transmitting than the original coronavirus we were dealing with a year ago. And that means that you have to be prepared to look at the evidence and to be prepared to shift your position. That's uncomfortable for decision makers. You normally want a fixed point to make your choices around. Yet actually we had to be nimble all the way through this. So trying to plant your feet firmly in the ground and say there'll be no change from this position, I think is a big mistake. The other point I think that we've really learned is that We really didn't know a great deal a year ago compared to what we know now. That means the choices we make now are much better informed, but it means that actually we're having to really learn as we go in a very uncomfortable way just over a year ago. The final thing I'd say is the importance of being straight with people. You know, these have been really uncomfortable choices we've had to make in the government. Really difficult choices for people to make with their friends and their family, particularly as we've intervened in such an extraordinary way in the way that people live their lives. Without the honesty about the difficult choices we're grappling with, I don't think we'd have seen such a overwhelmingly fabulous response from the people of Wales. People really have tried to do the right thing in overwhelming numbers, and that puts us in a position now where coronavirus is significantly suppressed from where it was at Christmas and the turn of the year, and we're able to have this path out. A deliberately cautious, planned approach where we look to keep faith with the public as we look to see the end of the pandemic. Thank you. I've now got Steve Bagnall from the Daily Post.
Thank you, Health Minister. Do you have any further information on the outbreak in the Holy Island and the Holyhead areas on Anglesey? And are any local lockdown measures now being considered, or can they be ruled out?
I've had a conversation together with other ministers and the leader of Ynys Môn Council last week. We're looking at the position on a regular basis, and I've had more advice over the weekend. There are more conversations going on, not just with the council, but with the health board, the police and other actors. Now, we're in a position where the rate of increase appears to have slowed a little, but it's still uncomfortable, and it is centred around one part of Anglesey, so it's not widespread across the whole local authority area. That does mean that we're looking to introduce some new measures around increasing access to testing to help us understand where the infection is, and to try to persuade people to do the right thing, to look after themselves, their family, their friends, but also the businesses they'll be going into as well, either as workers or indeed as customers, to try to make sure that if we can, that we can avoid introducing further measures. But local measures are always a possibility, not just in Holyhead, but also, I know you're Daily Post reporter for North Wales, but we've also had some localised challenges in only part of Merthyr Tydfil as well. We haven't ruled out the need to take those local measures, but we're looking to try to see if we can persuade people to go along with what we're looking to do to find more cases, to identify where there's a problem, and to persuade people to do the right thing, to avoid those much bigger and more difficult measures that would affect people and businesses in a way that I think most people would find uncomfortable. But if that's what's required to keep people safe, then that's what we'll be prepared to do.
Thank you, Health Minister. And with reports the EU is threatening to restrict exports of the Oxford Astrazeneca vaccine to the UK, what is your view on this? And could it delay people in Wales getting their vaccination?
Well, I don't think we're entirely reliant on exports from the European Union into the UK for the Astrazeneca vaccine. We do have exports of the Pfizer vaccine, but there doesn't appear to be a challenge for Pfizer to meet their contractual obligations with European countries and the obligations they signed up to deliver vaccines to the UK. So actually, I think there's a real requirement for all of us, commentators, decision makers, but also those people at member state level, the UK government and indeed the European Union, to take a step back and be calm about the position that we're in. We know that European countries have stocks of the AstraZeneca vaccine that they can now deliver, given the significant boost that the AstraZeneca vaccine has had on its safety, with the European Medicines Agency confirming that it is safe. The previous concerns about blood clots have not been well founded. So that's really good news. So their own vaccination programs within European Union countries can continue to step up again. We need to be able to work together to understand what we can do to help each other to meet our obligations. That's both the UK being a good partner about our own obligations to European Union countries in this area and others, as well as us not going down the track of sabre rattling, which I don't think really helps us. I think the biggest part about that is that I think it just leaves the public cold. I don't think that members of the public in any European Union country or in the UK will be impressed by politicians rowing and getting in the way of the safe and effective delivery of the vaccines to people, to get them into people's arms. So that's the overriding priority, because we know that will keep more of us alive and avoid significant harm and help the whole continent of Europe to move towards what we hope will be a new normal with less significant interventions required to avoid real harm from coronavirus. Thank you, Steve. I've now got Rob Taylor from Wrexham.com.
Good afternoon. You've mentioned earlier plans to improve the health service, but in simple terms, won't Wales's COVID recovery be hindered by the poor performance in health over the previous 2 decades? And with the North Wales Health Board emerging from special measures, won't the North be starting from even more on the back foot? And if so, what will be done to address that gap?
No, I think that's a rather miserableist approach that doesn't take account of reality, if I may say so, Rob. If you think about where we've been, before the pandemic, we'd seen several years of consistent progress on reducing waiting times. We did then see a challenge immediately before the pandemic as a direct result of the tax and pension challenges introduced by the UK government. You don't need to take my word for that. You can go and talk to the British Medical Association and they'll tell you that had a direct impact on people's ability and willingness to work. But we'd seen real progress made, and through austerity, we'd prioritised the health service, so it had year on year above inflation growth during all of this term and most of the term previous. So we've invested in our health service, but the reality is that austerity meant that our public services overall were not as resilient as they would otherwise have been before the pandemic started. And of course, it is a matter of fact that the Health Board in North Wales has made real progress forward. That's why they came out of special measures following the tripartite engagement. So our regulators and Audit Wales, they meet, they have a conversation. I then get advice from the Chief Executive of NHS Wales, and I acted on that advice because it was the right thing to do for the Health Board and the service to make further progress. So I think people can have more optimism, not just in North Wales, but across the country about the ability that we have now to see further improvement with a real can-do attitude we've demonstrated through the pandemic to change services, to improve the way we deliver. And there is an opportunity within all of this to deliver a genuinely sustainable health service where we're in balance with the need that we have and able to see people where they most need to be seen to deliver the right care at the right time and in the right place. And I think that's absolutely the case in North Wales too, where, as you know, we're already committed to investing further in, for example, the reshape of orthopaedic services. So I think there's room for optimism that is based on reality.
Thank you. And today's announcement about COVID-secure elections and related funding, it notes that voters and staff should wear a face covering unless exempt. In other countries, FFP2 masks are a standard for similar indoor activities such as shopping, but the Welsh Government advice still has the lower minimum standard. A year into this, are you able to explain what is COVID secure about a tightly wrapped scarf around your face?
Well, actually, our advice and our guidance suggests that people wear appropriate face coverings, including the recommended, which is the 3-ply covering, the one that I wear, the Welsh Government mask we introduced. They're widely available. And the challenge here is we've actually got advice from a range of independent experts working together, and they give advice to governments. Our Deputy Chief Medical Officer sits on that group that reviews the evidence on whether or not we need to change the grade of masks that people use and what that will then mean for the impact of the spread of coronavirus or otherwise. So we continue to review the evidence. And again, as I said in answer to a previous question, when the evidence changes, you have to be prepared to change your decision. And we've had to do that at various points in the pandemic. So if the evidence and the advice changed around those face coverings, what's appropriate for the public to use, then I'd have no hesitation in changing the advice and the guidance and the decision that the Welsh Government would make to help keep the people of Wales safe. Thank you, Rob. I've now got Tom Magner from Carers World Live.
Thank you very much indeed, Minister. Before this briefing, Mike from South Wales contacted us to say he'd heard about some sort of NHS recovery plan. You've mentioned a couple of documents in previous answers, and he's curious specifically to see if there's anything in any of this for unpaid carers. Excuse me, unpaid carers. Could you enlighten him?
Well, for everyone, whether you're an unpaid carer or not, there's an interest in seeing the National Health Service recover from the challenges we've all been through. Actually, we have signed off. There'll be announcements later in this week that I won't spike by announcing them now that are definitely about what we're prepared to do to support unpaid carers specifically. But this is really about how services recover and recover together. And that would definitely affect unpaid carers, both themselves as users of the health service, as indeed the reality that most people who are being cared for by an unpaid carer, they often have healthcare needs as well. So in that sense, yes, but specific measures targeted at unpaid carers, You need to wait another few days, and then I hope that you and the unpaid carers across the country will be positive. I should say, when I filled out my census form yesterday, I did recognise there was a question that would help us to identify further the number of people undertaking unpaid carer tasks. Hope everyone has filled out their census form and filled out that question in particular. That certainly will give us a much better idea of the number of unpaid carers in Wales and across the UK.
Thank you for that. Just after you finished your opening statement a little bit earlier, another viewer, again from South Wales, messaged me to say, and I quote, "The lack of acknowledgement again so far during this briefing of unpaid carers is," she says, "contemptible." She carries on to say, "We prevent people reaching the NHS and burdening services. Unpaid carers are experts by experience. There's a lot of words, but Welsh Government are short on cutting-edge progress towards making them the third pillar of health and social care in Wales." Be interested in your reply. Thanks.
Well, as you know, Tom, we've regularly talked about unpaid carers during these briefings. It's been a pleasure to listen to you and to have your questions, which are always gently put, but not always gentle questions to answer. And that's because you've been making the case for unpaid carers, and it's been part of what this government has regularly considered, with not just the resource we put into providing more respite for carers, the conversations we had about making sure we could have an inclusive approach to unpaid carers in our vaccination programme, which we are delivering now as well. And as I say, we'll have more announcements for the future as well. So actually, unpaid carers have been regularly within the thoughts of the government at each stage during the pandemic, and will be so in the future as well. So as we reform health and social care, as we look to restart our economy, unpaid carers won't be forgotten, and they haven't been forgotten at any stage in the life of this government, and certainly not in the last year and more. And I certainly appreciate the efforts unpaid carers make, and as I've said on many occasions, I undertake some unpaid caring duties myself, so I have some personal insight into this as well. I hope that everyone who is watching will have felt that we've tried to take account of the needs of all parts of the country, the communities people live in. You won't always hear those groups mentioned individually from this platform, but this has been a genuine national effort to get us to this point over the last year. We need more of that together in the weeks and months ahead as we look to navigate our way out permanently, I hope, from this pandemic and to remake a new normal for a better Wales. So thank you all for watching not just this press briefing, but all the others in the past. I look forward to speaking to you in whatever capacity the voters decide in the near future. Many thanks.